Hi, my name is Brian and welcome to the Week 3 discussion. Because bipolar disorder can involve depressive episodes, the two conditions are sometimes confused. The primary distinction between the two is that whereas bipolar disorders involves mania-like symptoms, depression is unipolar, meaning there is no up stage. According to the Diagnostics and Statistics Manuals of Mental Disorder, 5th edition, a person must have both a major depressive episode and a hypomanic episode in order to be classified as having bipolar 2 disorder. These can happen at any time during a person's lifespan. At least 4 days of high mood changes, such as feeling of increased energy, anger, and expansiveness, are necessary for an episode of bipolar 2 hypomania. You must experience at least 3 of the following signs throughout this time. You must have 4 of the following signs if your mood has only been irritable. 1. Exaggerated sense of well-being and self-confidence. Grandiosity. 2. Decreased need for sleep. 3. Unusual talkativeness. 4. Rushed, scattered thinking and racing thoughts. 5. Attention-focused issues, distractibility. 6. Psychomotor agitation, which is an increase in purposeless physical activities, restlessness, pacing, tapping fingers, and the sorts. 7. Impulsivity, poor decision-making, and risk-taking. All of these heightened, wired feelings and behaviors can be attributed to a substance, and they have to be cannot be attributed to a substance, and they have to be so uncharacteristic that other people will take notice. At this time, I want to take a moment to address some thoughts about recent researchers have had. In 2018, the Canadian Psychiatric Association published in the Canadian Psychiatric Journal an article by Molly, Alfred, and Irwin titled Bipolar 2 Disorder is a Myth, where they share, despite the benefits of having shown a spotlight on bipolar disorder, we feel that the concept of bipolar 2 has run its course and served its purpose, and research has failed to demonstrate that a distinct bipolar 2 subtype exists. Hence, we argue the terms should now be refined and removed from their lexicon. I'm not here to argue that today, only to present the idea for each one of us to further investigate. There is a great importance for separating bipolar diagnosis from depression. The medical doctor, Dr. Park, shared in his article titled Depression in the Primary Care Setting, located in the New England Journal of Medicine in 2019, said, "Screening for depression and suicidality is important in primary care. Major depressive disorder should be distinguished from bipolar disorder, for which treatment is different. Depression is a frequent and dangerous mood illness, also known as major depressive disorder or clinical depression. People who are depressed have constant feelings of despair and hopelessness, and stop being interested in the things they used to like. In addition to emotional challenges brought on by sadness, some people may also experience physical symptoms, including persistent pain or digestive problems. Depression must be diagnosed when symptoms last for at least 2 weeks. The following criteria are listed in the DSM-5 as necessary to diagnose depression. A minimum of 5 symptoms must be present for at least 2 weeks, and at least one of these symptoms must be either 1. A depressed mood, or 2. A lack of interest or pleasure. 1. Depressed mood most of the day, nearly every day. 2. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. 3. Significant weight loss when not dieting, or weight gain, or decrease or increase in appetite nearly every day. 4. A slowing down of thought and a reduction in physical movement. 5. Fatigue or loss of energy nearly every day. 6. Feeling of worthlessness or excessive or inappropriate guilt nearly every day. 7. Diminished ability to think or concentrate, or indecisiveness nearly every day. 8. Recurrent thought of death, recurrent suicidal ideation without a specific plan or a suicide attempt, or a specific plan for committing suicide. To receive a diagnosis of depression, these symptoms must cause the individual clinically significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms must also not be a result of substance use or another medical condition. I believe that while the distinction between bipolar 2 and depression may be tricky, the key element to look for is that up or hypomanic stage, and because of this fact, I think I would be able to more easily be able to differentiate which diagnosis was more appropriate for the client I was seeing, and I do not believe I would have too much difficulty.